Do that. I'll put it.
We all set, Tanisha? Good morning, everyone. And first of all, we'll ask Tanisha to do a roll call of the board, please.
Yes, Chairman. I'll begin with Norman Boyd.
Here.
Russell Crutchfield.
Here.
Cynthia Rucker. Cynthia Rucker. Roger Folsom.
Here.
David Cruz.
Here.
Anthony Williamson.
Here.
Melva Lee. Here. Shane Mobley.
Here.
Robert Coles.
Here.
Chairman, that concludes my roll call.
Thank you, Tanisha. We have a combination today of people on the Zoom call as well as in person here. Myself and Shane Mobley on the board has joined us, and Russell Crutchfield and Dr. Melva Lee are here in person today. And so in the near future, we'll be, I think, back in person along with in-person public, but that has not happened yet, but will in our future. So thank you for all of you for taking time today for participating in our board meeting. I think from the roll call, we have a quorum, so we can conduct business, and I'll call the meeting to order. And the first thing on the agenda today, is just as an overview of that, we'll have, as a board, we'll be asked to vote on 3 different areas. 1 will be for final approval and 2 initial adoption. And we will get into those, of course, with the agenda. The first thing on the agenda is approval of the minutes of the June 8th meeting. And then Dr. Rucker could not be with us today. And I'd like to call on Russell Crutchfield and see if he has had an opportunity to review the minutes and can in fact recommend approval.
Well, good morning, everyone. I have reviewed the June 8th, 2023 Board of Community Health meeting minutes and found them to be in order. And I move that we approve the June 8th, 2023 board meeting minutes.
Okay, the motion has been made for approval of those minutes from the June 8th meeting. Is there a second to that?
Second.
Dr. Lee has seconded that motion. All in favor say aye.
Aye.
Aye. Aye.
Opposed? Abstaining? Hearing none, the minutes are approved. Thank you, Russell. Thank you very much. In my opening comments, I'm going to cover one area. As consistent with the bylaws of the Board of Community Health, we are to elect officers, 3 officers, the chairman, secretary, and vice chair each year. And so to do that, I'm to start, and I am naming a nominating committee that will review the officer positions and make recommendations at our August meeting for approval or vote on officer positions. And the committee is the same as last year. I've asked David Cruz to chair that committee, along with Dr. Lee and Anthony Williamson will be the 3 members of that committee. And they have asked that any board member that has input or recommendation would like to give input into that nominating process, please contact any one of the nominating committee between now and the next meeting, and that we can consider that in the nominating process. Any questions from anyone from the board on that? Hearing none, I think that will conclude my opening comments, and I'll move to the next item on the agenda, which is the commissioner's report. So Commissioner Noggle, would you please give us your report?
Thank you, Mr. Chairman, and thank you, members of the board. And thank you for those of you that were able to join us today, and looking forward to showing you around the new space in just a little bit. A few updates from me this morning. First, just want to congratulate the department, our team, and all of our partners on the successful launch of the Georgia Pathways to Coverage program. We'll be officially celebrating with a few of them this afternoon, but that was a It has been a multi-year, 3 or 4 year project. And I'm really, really proud to report that we launched that on July the 1st with nary a technical issue that I'm aware of. Very few calls with technical issues, and applications are being received and coming in, and we're very, very excited about being able to provide another option and another coverage opportunity for Georgians for Medicaid and insurance coverage in addition to other options. So very, very proud of all the hard work and the team effort that went into that. As you've, I'm sure, read in the news each of the last few months, and again this morning, and as I suspect will continue over the next year, our efforts to redetermine eligibility for Medicaid members continues. I think reports show that about 95,000 members lost coverage during the month of June for various numbers of reasons. We certainly expect that a number of members lost coverage due to procedural reasons, failure to return paperwork or to respond, but we also expect that many of them maybe did not respond because they had coverage elsewhere or were aged out of eligibility. I will say that the department is actively pursuing even further and additional opportunities to pursue outreach to our members and education. We're especially excited about opportunities that exist as we start to get back into the back to school registration period. Many of our members are children and mothers. And so we hope that we'll be able to leverage some of those back to school activities to engage our members and make sure that they're looking out for the notices that are being sent to them, both via mail, phone calls, text reminders. Our CMOs are actively engaged. We're launching some additional provider capabilities, I believe next week, so that individual providers will be able to go into our system and see redetermination and renewal dates for members as well. And again, I expect that we will continue to release a report every month with those numbers as they're updated, but we are committed to continuing to do all that we can to make sure that no one loses coverage that should have either the ability to remain on Medicaid or to get connected either to pathways or to the marketplace or some other coverage option. I do want to highlight one item that is not an official board item today, but for awareness. During the public health emergency, CMS had permitted many states, ours included, to apply for a waiver, and we were one of them that was approved, to permit legally responsible individuals to provide personal support services, so non-skilled support services to children receiving services in our Georgia Pediatric Program, or GAP program, which is for medically fragile children. These individuals often included responsible family or parent caregivers. That authority ended on May 10th or 11th with the end of the federal public health emergency. However, CMS has granted many states, Georgia included, a 6-month extension to ensure continuity of care for our members. So that has been granted to Georgia. It is scheduled to run through November the 11th. Again, no formal board item is required, but we will post that approval notice online for public comment, should the public wish to comment on that. I do want to acknowledge, as I generally like to do, some of our staff that are celebrating DCH and state milestones. Tiffany Johnson and Kara Garrett with HFRD, Leah Peacock with our Medicaid Medical Assistant Plans Divisions, Levatrice Jordan, Michelle Prescott, and Terry Portis in our Office of Inspector General, and Larvetta Mims with our HFRD department are all celebrating milestones with the department today, this month, and want to thank them for that. It is my last board meeting with the department, and just want to thank not only our board members for their support and confidence and encouragement over the last few years, but also the team. Our legislative partners in the governor's office. We have accomplished a great number of things in the last year, and I'm really, really proud of all the things. I made a list, but I won't go through it, but some really historic things that the department's been able to achieve over the past 2 years. This team is fantastic, and they are really capable of achieving a lot and will continue to do so and rise to the challenge of whatever comes before them under Russell Carlson's leadership starting in August. So thank you to them. I will miss the work. I love the complexity of what this department does. It's been a great honor to sit in this chair for a bit, but I'll miss the people most. So thank you, all of you on the board, and to our staff for all that you've done. I know I've pushed a lot. We got a lot done. Lynette laughs. I was trying to tally up this morning the number of state plan amendments that we've been through in the last 2 years, and it's, I think, somewhere north of 25. In addition to the directed payment programs worth over $1 billion to our hospitals. We've got one outstanding with CMS. I hope we get approval on, we'd have a few. Attestation. Lynette's whispering to me, the last one I was hoping to get done before I left was the removal of the attestation requirements for our providers, which apparently came in this morning, late breaking news. So that will also immediately result in provider rate increases for providers around the state. So another thing to put in the win column over the past couple of years. So thank you, Lynette. It's the whole team for supporting a pretty ambitious and aggressive plan over the last couple of years, but you rose to the challenge beautifully, and thank you all. Happy to take any questions, Mr. Chairman.
Yeah, any questions, comments for Commissioner? Thank you for your comments, and certainly they're appreciated by this board, and we'll talk a little bit more about that toward the end of the meeting. But the accomplishments have been significant, as you said. We recognized that as we went along and approved all of the things that you came to our board and really positive kinds of things. Any other comments or from the board at all at this point? Questions?
Yes, I'd like to thank the commissioner for all of her work and making Georgia a better place for everyone. And I really appreciate that as a provider. This made a great impact. So I really appreciate that very, very much.
Thank you. Okay, with that, to move into our agenda items, and the first thing is Lynette Rhodes will present medical assistance plans that she will ask for consideration for final adoption. So Lynette, you may proceed.
Yes, thank you. Good morning, Commissioner, Chairman, and board members. Again, thank you for the opportunity to present. I come before you this morning requested final adoption and approval on a proposal to include the coverage of blood pressure monitors as a new state plan requirement. Currently, the Medicaid program does not cover blood pressure monitors. Per the provisions of the amended state fiscal year 2023 Appropriations Act, the department was directed to revise its rules and policies to allow for the coverage of blood pressure monitors for all Medicaid members. An opportunity for public comment was held on June the 14th at 11:30 a.m. Written comments were due on or before June the 21st. We did not receive any oral comments. However, we did receive one written comment from Ms. Laura Bracci with the American Heart Association. She is the Director of Government Relations for the state of Georgia. The American Heart Association recommended coverage of validated self-measured blood pressure monitoring devices for use to confirm a diagnosis of hypertension and to manage hypertension to improve blood pressure control. Per the American Heart Association, self-measured blood pressure monitoring devices should be validated for clinical accuracy and designed for in-home use. The American Heart Association recommended the use of blood pressure monitoring devices listed on the U.S. Blood Pressure Validated Device Listing, also known as VDL. In response, the department fully supports the use of blood pressure monitors that demonstrate clinical accuracy and are designated for in-home use. This may include blood pressure monitoring devices that extend beyond those listed on the U.S. Blood Pressure Validation Device Listing. And at this time, I'll pause for any questions from the board.
Any questions, comments from the board, please?
I have a question. Is that for remote patient monitoring, or is this just a one-time reimbursement for that?
Just one-time reimbursement, just for the device.
Okay.
Any other questions, comments? Hearing none, is there a motion for approval for final adoption? Motion has been made for final approval by Dr. Lee. Is there a second?
Second.
Council Crutchfield has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved.
Thank you.
Thank you very much. Next, we'll move to the next item, which will be asked to consider for initial adoption, at which time then we'll go out for public comment. But Brian and Nino will make that presentation on rules and regulations for healthcare facilities.
Good morning, Mr. Chairman, board members, and Commissioner. This morning, I'm pleased to introduce rules and regulations for adult residential mental health programs for your consideration for initial adoption. These are proposed new regulations within the healthcare facility regulation chapter to establish minimum standards for adult residential mental health services programs. If approved, these rules will appear in subject 111.8-2. These rules and regulations are required by Georgia Code beginning at OCGA section 37-3-200. By way of background, adult residential mental health programs are facilities of 4 or more residential beds, which provide subacute residential psychiatric services for mentally ill persons that are at least 18 years of age. These facilities will operate 24 hours per day, 7 days per week, and will provide intensive short-term non-institutional treatment in a supportive therapeutic setting for prevention of or transition from acute psychiatric hospitalization. These rules and regulations establish minimum standards for facility governing body and administration, licensure requirements and enforcement processes and penalties, admission, discharge, care and services, building and functional design standards, staffing requirements, criminal background checks, medication administration, storage and dispensement, food and nutrition, disaster preparedness planning, establishment of a procedure for enforcement of individual rights and grievances, record keeping maintenance requirements, procedures to protect the confidentiality of individuals that are seeking treatment, departmental inspections, invoking the powers of the Disability Services Ombudsman over facilities, and providing for the department's discretionary waiver and variance authority. An opportunity for public comment will be held on August 23rd, 2023 at 1 p.m. via Zoom. The agency will also accept written comments submitted on or before August 30th, 2023. Mr. Chairman and Board, I respectfully request your favorable consideration of these rules for initial adoption, and I'm happy to answer any questions you may have.
Are there any questions or comments for Brian from the board, please? Hearing none, is there a motion for approval for initial adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Roger Folsom made the motion for approval. Is there a second?
Dr. Coles, second.
Dr. Coles has seconded that motion. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, Brian. Thank you very much. And we'll look forward to your public input and coming back for any modification or approval at that time.
Yes, sir. Thank you.
Moving to the final agenda item here that we'd be asked to consider today, and Melanie Simon, our general counsel, will present rules and regulations for healthcare facility regulation as well.
Good morning,
please.
Mr. Chairman, Commissioner Noggle, and members of the board. The Division of Healthcare Facility Regulation presents rules today for initial adoption. These rules are found in Chapter 111.825 of the Department's Rules and Regulations, and they deal with licensing, general licensing requirements, and enforcement. So there are two proposed changes. The first change pertains to long-term care facilities and nursing homes specifically, and this is just a cross-reference. You may recall that earlier this board approved rule changes that impose a $1,000 a day mandatory fine for nursing homes that fail to give at least 90 days notice of a closure or a change of ownership or other material change impacting residents. That change was put in the nursing home rules. We're simply adding a reference here as well in the enforcement rules to make sure that facilities are aware of that potential sanction. The second change to these rules adds a sanction minimum fine of at least $5,000 for violations of OCGA 3173.5. And this fine applies to hospitals and related institutions, which would include ambulatory surgical centers. And I will point out with all of these sanctions, if a facility is assessed a fine by healthcare facility regulation for a violation of rules, those are appealable and those hearings go to the Office of State Administrative Hearings. We will be having a virtual public comment hearing on August 23rd at 2 p.m. and will accept written comments on or before August 30th. And we are respectfully requesting consideration for initial adoption today. And I'll pause for any questions you may have.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
A motion to approve.
Russell Crutchfield has made the motion for approval. Is there a second?
Second, David Cruz.
David Cruz has seconded that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Melanie, thank you very much.
Thank you.
That concludes our agenda items today. In my closing comments, I'd like to follow up on Commissioner Nago and her comments, being her last meeting as she leaves the Department of State Service this month and moves on to her next career position. And I'm sure that it will be successful as well, as because you're the type of person that will make it successful. And we have so much appreciated as a board in working with you and all of the things that you have accomplished, and there has been many for certain. But Denisha said I could present, if I want to present two things to you. And the first thing, Denisha said I could present this actually from the governor, and the governor's office is a commendation recognizing your service to the department and to the state.
Thank you.
So I'll present that to you. And secondly, in recognition from our board, we have prepared a plaque for you to have on your desk in your new assignment. It recognizes your 2 years of contribution as commissioner at DCH and your 18 years of service for the state of Georgia. And this is on behalf of our board.
Thank
and
you
we
so much.
so much enjoyed working with you.
I appreciate it.
Thank you.
Thank you.
I'll pass that over to you. It's a little heavy.
Thank you so much. It's been an honor.
Thank you. I also recognize at this point that we will be working with a new commissioner effective August the 1st. And that has been announced by the governor's office, and he is with us today as well. At Russell Carlson, the chief health policy officer for DCH. And Russell comes to this position as the new commissioner with a long history and distinguished history of state government positions. And Russell Crutchfield told me a while ago, he said, you were the first person he met when he joined the state government in state government. So he said it was a long time ago. I didn't think you were that old, but
He still looks exactly the same.
he looks the same.
Like the board members said. Thank you, Mr. Chair.
Well, welcome, Russell. We look forward to working together. Is there anyone else that knows of any new business or anything that needs to come before the board at this time? If not, we are adjourned, and I believe that for those of us here, we are going to be treated to a tour of the new office. So thank you all very much for joining today, and the meeting is adjourned.